Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's Zoom news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and briefly introduce who's on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Amantier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. This time, we'll now go ahead and turn it over to Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
Let me get unmute and then I'll tell you I'm fine. And Happy New Year to everyone. I appreciate the panelists being on with us this morning. Our big news today is that our Civic Center vaccine supply is dwindled. Actually, we are closing the clinic until we get more supply from the state. And so while we're disappointed to have the doors closed where we could be vaccinating people, we've known this was going to be part of the process. We've known that it was going to ebb and flow as our vaccine supply ebbs and flows. But we're getting new vaccine every week. The state's getting new vaccine every week. And the manufacturers are producing millions of doses every week. So I want people to know that we know this is going to be a process as it rolls out, and just be checking AmarilloAlerts.com for our vaccine availability. We're going to keep that clinic open as much as we can, and we're going to vaccinate as quickly as we can every time we get supply. And your best way as a citizen to know whether or not we have supply is to check that website. It will change real time when we have it and when we don't have it. So that's our best communications tool to citizens. I also just want to thank the staff. The staff has worked so hard for the last 10 months, but this vaccination clinic has been really a display of them working as a team, multiple departments, Parks and Rec, library, the city manager's office, of course, public health, the Civic Center staff, communications. So many different departments have come together to make this vaccination clinic work. And it's a big operation. I told someone just this morning that when you vaccinate 3,000 people, that means someone stood and filled 3,000 vaccine syringes. They were like, it doesn't come already in syringes? I said, no, it doesn't. They're warming the vials, they're getting them in the proper temperature, and then they're filling the syringe. So when you think about all of the steps involved in operating this clinic, it's a huge operation. It's an important operation. It's a historic operation. And I just want to give a shout out and a huge thank you to our staff and to the leadership of our city manager, Jared Miller. They've done an excellent job in putting our citizens' health and safety at the forefront and getting us vaccinated quickly. I'm getting questions around the community about how quickly, well, they're framed up in how quickly are we going to return to normal? And I know that's what we're all craving and have our eyes toward. But really people are beginning to ask me, can we have this banquet in February? Can we have this large group gathering end of January? And so I know there are questions about timing. We do have a tremendous amount of hope that the vaccine is here now and we're seeing our friends and neighbors getting vaccinated. The most important thing I want to ask of you as a community is that we continue to keep an eye on our hospitalization rate. The governor set a high hospitalization rate number as 15, and we are still way over 15% hospitalization rate. So if you're a leader of an organization or a business that involves group gatherings, I would ask that you would watch that hospitalization rate and not look toward having those events again until we are down and plateaued at under 15%. Every time we vaccinate someone, it's going to increase our chances that that number is going to go down and stay down. But until we have really reached under 15% and held it there for a while, our hospitals are still vulnerable, and our medical staff is still vulnerable to fatigue and being overrun if we're not watching that number when we're planning our events. So please keep wearing your masks, please keep social distancing, and please keep that hospitalization rate in mind as you begin to make plans going forward in the spring about events or things that you would like to get back to normal on. We don't want to trip up here at the finish line and not finish strong as a city. That's what I have this morning, Dave. Thank you.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you today?
I'm well, Dave. Thank you. So we have a lot to cover this morning, and we'll do that as quickly as we can. But I want to just share all of the information that we have with you this morning. As of yesterday, there were a total of 29,690 total cases of COVID-19 in Potter and Randall counties, 15,391 cases in Potter County, and 14,299 cases in Randall County. We have a total of 26,067 recoveries, and we're up to 512 deaths here in our community. That leaves us with 3,111 active cases, and each of the cases do represent a unique individual. The total 7-day rolling positivity average is up to 13%, just up from 9% last week. So again, just like the mayor said, we want to make sure that we're still holding strong to those social distancing measures, masking, washing our hands, limiting our gatherings as we're still in this marathon that we're running with COVID-19. The positivity rate at the drive-through testing site is at 13%, and the 5-day positive new case average is up just a little bit to 199 new cases per day. The public health drive-through testing site remains operational. Individuals can call 378-6300 to be screened and directed to the test site. GA32's hospitalization rate for our 25 county Panhandle RAC region is over 15% for more than 2 months now. And yesterday, the Panhandle's, the RAC hospitalization percentage was at 21.28%. And so that means that just over 21% of all hospitalized patients have COVID-19. Our community does remain at status level red. Conditions remain consistent with the threshold indicators being at status level red. Again, please remember to wear your masks, social distance, wash your hands, and limit those gatherings. Our outpatient bamlanivimab infusion center remains open, and we're serving patients. We continue to accept referrals from local providers for patients who meet the EUA criteria for infusion. As of today, the Amarillo Public Health Department has given all of the vaccines supplied by the Texas Department of State Health Services. Our clinic at the Amarillo Civic Center will open again as soon as we receive another shipment of vaccine. And I'd like to take a moment to give you some highlights. In 8 days, we have given 12,000 doses of vaccine. Our highest throughput day was just over 2,800 people served, and each day we improved our wait times. Social distancing was observed to keep our people safe, and we will get the second doses as scheduled so that we can give the second dose to everyone who received the first dose of vaccine. A few things to remember about the COVID vaccine. You must be over the age of 18 for the Moderna vaccine and over the age of 16 for the Pfizer vaccine. We're still in phase 1A and 1B for that vaccine allocation, meaning the frontline healthcare workers and people over 65 years of age and people with chronic healthcare conditions are being vaccinated currently. The state has not defined a group beyond 1B since we'll be vaccinating that 1B group for some time. You're not eligible for vaccine if you have had an allergic reaction to a component of the vaccine, had another vaccine in the past 14 days, like your flu shot or your shingles vaccine in the last 14 days, or you know that you're going to get a vaccine in the next 14 days, again, like your shingles vaccine or your flu vaccine, or if you've had a monoclonal antibody infusion in the past 90 days. So some of those things are just good to remember if you're thinking about getting your COVID vaccine. I also want to say thank you. Thank you to our community who has showed up in force to be vaccinated. I could not say thank you enough. I will also want to say thank you to our community partners who made this community event successful. BSA gave us an extra 1,000 doses so that we could continue to vaccinate into today. Brick Care provided wheelchairs and oxygens to serve our patients. Chick-fil-A donated lunch one day, and man, that really made a difference to our staff. The RAC provided additional wheelchairs and nursing support. So we had additional nurses so that we could make sure that we were shortening those wait times and getting more people through the lines. Our city staff, wow, I could not say thank you to our city staff more. The Civic Center staff, they are so flexible. Wow, we have an amazing Civic Center team. Communications, Amarillo Police Department, the fire department, transit, our library staff, we have an amazing city team. And our public health department, your public health department is amazing. Since March, they have been working so hard in response to the COVID-19 pandemic. They've stood up contact tracing, call centers, drive-through testing, the adalimumab infusion center, and now the most successful immunization clinic in Texas. And so I just want to say thank you to our public health team. As soon as we receive our next vaccine shipment, we will let you know so that you can come be vaccinated if you're in the 1A or 1B vaccine group. So please check at AmarilloAlerts.com for vaccine availability here in our community. There are other clinics who have received vaccines, so check out AmarilloAlerts.com for any vaccine availability. And that's all I have today, Dave. Thank you.
Thank you, Casey. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you today?
Hello, Dave. Hey, I can tell you what I'm not this morning, and I'm not anergic. So the term anergic is a term that we use when someone's immune system does not respond appropriately to a foreign invader. So 3 weeks ago, I got the first dose of the Pfizer vaccine, and it gave me a bit of a sore arm, but I didn't feel anything. And of course, the question was, well, gosh, is this thing really working or not? Well, yesterday I got shot number 2. I laughed, I cried, 2 thumbs up. Well, about 4 o'clock this morning, all doubt was lifted as to whether or not this thing is working. Well, so at 4 o'clock this morning, I woke up with shaking chills from the low-grade fever I got from the second vaccine. I'll tell you, I have never been so happy to feel so lousy in my entire life. You know, and a little bit of Tylenol took care of that. But what it told me is, aha, my immune system is responding to this vaccine now, and I'm delighted. You know, I've had a lot of people ask my opinion about, is this vaccine safe? So I'm gonna offer my opinion on this perspective on this. So just to remind you, the Pfizer vaccine and the Moderna vaccine, they work by teaching our cells to make a small part of the protein that is on the COVID-19 virus. And it's that protein that our immune system then responds to and recognizes as a foreign protein. Now, the other option is to get the virus. Virus is a very complicated biological entity with lots of proteins. It also has a genetic material in there. And we know that that virus infects and affects multiple organs in our system and our bodies, including the brain. So if I think about, I've got to pick my poison. Do I want to have my immune system respond to a small part of that protein and learn that that's a foreign material, versus having this virus infect my body and do whatever it wants to do in multiple organs? I'm going to err on the side of this vaccine, right? My hope is that this vaccine will prove to be as safe as we believe it is at the current time. My bigger worry, though, is I cannot assure that the long-term effects of this virus are not very serious. As we know, it goes throughout the body, and now there's a lot of evidence about its effects in the brain and the vasculature of the brain. So I'm going to err on the side of this virus. And I would encourage people to think about that in terms of as they consider getting the vaccine for themselves. Now let's talk a little bit about the numbers in Northwest. We have 78 positives today. That is 16% of our licensed beds. So again, we're still hovering around that 15% mark that the governor has pointed out to. We have 36 COVID patients in the ICU, and 17 of our 20 ventilators in use right now are going to patients with COVID-19. Now, you may have heard that December had the highest mortality for COVID-19 across the country. We had 74 people succumb to the virus in December at Northwest. That is a tie in terms of the second highest month we had. Right now, we've already had 14 people in January also succumb from the effects of the virus. So again, we are not out of the woods. Even though we're seeing less numbers, we're still seeing that the mortality is tragic from this virus. In terms of our outpatient testing, yesterday we had 17% of our outpatient tests positive. That's encouraging because we've been below 20% now for several weeks compared to 30 to 35% a month to a month and a half ago. And right now we have 28 of our staff quarantined. Again, that is down from 150 about a month and a half ago. So as we point out last couple of weeks, all the numbers are looking very promising. Now the remdesivir, that is the drug that we use in the hospital along with Decadron to treat patients. We have treated 651 patients with this medication, and currently we have 22 patients in the hospital currently on remdesivir. The drug the medicine that I've become more convinced in terms of its efficacy is this bamlanivimab. Right now, we have given 106 people in the hospital or as outpatients bamlanivimab. We have about 280 doses to go. I've been talking to patients who have received this. And what is very clear is the vast majority of people who get this feel better within 24 to 48 hours. So I would certainly encourage that the providers in the community to consider referring your patients who are appropriate for this monoclonal antibody to get this infusion, because it really does seem to help people who qualify for it. Just to end my talk today, I want to congratulate the city leadership and the public health department for the huge accomplishment they've done with that vaccine clinic down at the Civic Center. It is a massive enterprise to go from receiving that vaccine to getting it into people's arms. And quite frankly, Amarillo has knocked it out of the park. If you look at other cities in Texas, they've got vaccines sitting there because they can't quite figure out how to efficiently get it into people's arms. And that is not the problem here. So I want to personally thank the mayor, Jared Miller, Casey and her team, and all the people in the community that have worked very hard to make this clinic very efficient. It's worked beautifully. And I think we're going to see that we can return to normal much faster than a lot of other areas of the state as we continue to get this vaccine to the populace of Amarillo. That's all I have for today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Lementier, how are you?
I'm doing well. Thanks, David, and good morning, Amarillo. I think that we need to continue to certainly be very happy about some of the positive things that are happening with our efforts to combat the coronavirus. The vaccinations are a huge tool for us in our armamentarium to allow us to certainly do whatever we can to help us gain immunity and prevent severe disease, as Dr. Weiss mentioned during his commentary. There are so many facets of COVID-19 that are being displayed in patients who are naturally infected that are quite concerning. When you talk about the vascular complications, the neurologic complications, the respiratory complications, some of which are appearing to be very long-term, at least with our short knowledge of this virus, long-term meaning up to close to a year, if you will, based on what we've seen over the past 10 months with people having lingering symptoms. So absolutely, we need to do our own self-assessment of what we think the risk benefit is for us as individuals to say, should I get the vaccine? And in my mind, there should be very few people that are saying that the vaccine is not for them, meaning having the vaccine help prevent at least a severe infection from occurring. If it doesn't prevent you from getting infected, should be something that is very important for you to consider for your own health and potential complications. We are absolutely of the mindset that as a community, the faster we utilize the vaccine allocation that has been given to us, the more likely we are to continue to get additional vaccine from the state is a key. And that's why we were certainly happy to give part of our supply to the city, because they're doing such an outstanding job with getting that vaccine administered to so many people so quickly. Here at BSA, we are working very hard to make sure that all of our employees that are desiring to get the vaccine are getting it. We vaccinated over 1,500 employees and medical staff members combined. We are starting to look at ways to have that vaccine also be available in some of our clinics for outpatients that have the highest risk and meet the 1B criteria. So we'll continue to use our resources appropriately in terms of sharing them with the city as able, and certainly to be able to get them out as fast as we can, in addition to providing them to our employees and our patients that are seeing BSA facilities, if you will. We're also continuing to be aggressive with the monoclonal antibody infusions. I agree with Dr. Weiss that we're seeing some good success with those antibody infusions. We believe keeping people out of the hospital that have higher risk when they get infected, and very, very infrequent adverse reactions. Quite frankly, very close to zero with that number as far as adverse reactions. So we'll continue to supply those therapies. We're working with the city on the tent location that we have, and also at BSA Urgent Care Center, where we're doing a lot of infusions there through a scheduling process as ordered by patients' primary care physicians. Today at BSA, for our numbers, we have 111 patients hospitalized. That's less than where we were, but it certainly is not where we want to be, meaning that number needs to be a lot lower to help get our trauma service area out of that 15% or greater threshold, as outlined by the governor's order, where we have to be cautious about the services that we're doing at the hospital in order to preserve beds for potential COVID patients. We're using 53% of our ventilators right now on all patients ventilated. Of the 111 COVID patients, 48 of them are in the ICU, and 24 of those patients are on ventilators. We still have 81 total ICU patients at BSA. And to remind folks, our typical historical ICU framework allows for 48. So the only reason that we're at 81 ICU beds is because we've expanded into our intermediate care unit and converted all those beds to intensive care beds. And we have 2 satellite ICUs that we're utilizing in a pre-op holding area and our CAF EP lab, which were not originally meant to be ICUs. So we still are not past the concerning point where we need to get the burden reduced on the hospitals regarding inpatients that have COVID-19. As we said before, the flu numbers continue to stay low. At BSA, we're still at 0.7% of our isolates that are coming back flu positive for those that we're testing that have suspicion of disease. We do have 2 co-infections currently with flu and COVID-19. So again, that potential still exists. And in my mind is another reason why it's critical to get vaccinated, so that we don't have that co-infection lead to more severe disease in any particular individual. From our testing standpoint, through November, if you'll recall, our positive rates were about 28% of all tests done were positive for COVID. In December, that number dropped off to 17% of all of the tests we were doing were coming back positive. And January month to date, in the early part of the month, we're back up slightly to about 20% of all of our testing is showing positive for COVID-19. Whether that's a little bit of an effect after the holiday or just the time of year we are, unknown. However, I would say that we're going to keep a close eye on our testing rates and continue to test aggressively for folks that have any kind of suspicion of disease. We're continuing to restrict elective procedures at the hospital that require inpatient beds because of the demand on our ICU beds. And we're working with our surgical leadership to make sure that procedures that move forward have good indications and that are not potentially able to wait without having adverse consequences for patients, obviously, which is our primary concern. Overall, our staff has continued to work now. I was looking at our calendar. It's been almost 10 months, folks, that we've started since our first patient in the hospital, which was mid-March of 2020. So just about 10 months now we're approaching of dealing with inpatients afflicted with COVID-19 in the hospital, hospitals plural, in our medical community. And I think it's critical for us to remember to thank our healthcare workers when you see them out in public. When you're able to talk with them, if they're family members or friends, remember to thank them. This has been an ongoing journey for everyone. And those that are on the front lines have been sacrificing the most in terms of taking care of these patients, some of whom are your loved ones, I'm sure. So again, BSA wants to thank everybody for all the efforts to combat the virus. We need to continue to work together. We're going to continue to try to figure out ways to vaccinate as many people as we can. And I would just, again, ask to ignore some of the misinformation when it comes to the vaccines. These are our best friend right now. And the last thing I'll say is that there was a trial that just came out in New England Journal of Medicine this week that was a study out of Oxford University. It looked at natural infection. The good news about that is that it may be that we have some immunity for a period of up to 6 months with antibody protection due to natural infection. Remember that vaccines are designed to give a far more brisk immune response than natural infection. So if that is a 6-month window, potentially when you're infected with the virus, we're hoping that this is going to be at least 12 months or longer potentially with the vaccination. And just because you're infected previously does not mean that you should not be vaccinated. So again, thank you, and we'll talk to you soon. Thank you.
Thank you, Dr. Lemmontier. Let's now go to Dr. Rodney Gonzalez, Director of Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. Thank you, and thank you for this opportunity. You know, the focus here has been on vaccinations, and I'm going to talk a little bit about our vaccinations. And so we have vaccinated over 500 of our employees here at the Amarillo VA, and that includes our Lubbock campus also. And so we are continuing to vaccinate employees that want to be vaccinated, but we have also vaccinated the veterans who want to be vaccinated that live in our community living center or nursing home that sometimes can be referred to long-term care facility. But we began this week beginning to vaccinate some of our veteran outpatients. And today we're increasing that number. We have, just shy of 1,000 doses here at Amarillo that we are using, and we'll continue to use for those. And so just want to remind veterans, if you are high risk, please talk to the team here. And if you meet that high risk criteria, we're going to get you scheduled for one of those appointments. I do not know when we'll get in more. We are placing our orders every week to get more vaccine and continue to do that. Lubbock also has a couple hundred doses. They right now are focused on their employees because they got it later, but shortly they're going to be starting with their veteran population also. Now, I do know some of our veterans are getting vaccine from other locations, and I want to thank once again the city of Amarillo for being so open in vaccinating those that are at high risk, those that meet the Texas definition of criteria, regardless of that status, to include some veterans. I know I've had a couple of veterans mention to me they've been vaccinated either at the Civic Center or I think a couple were, one was United. And so appreciate that. I do want to remind those veterans, please let your team know that you've been vaccinated so we can make sure that your record annotates that so we know to focus on other veterans for getting vaccine when we get it. Now our numbers, we currently have 8 hospitalized COVID patients. 4 of those are in our ICU, and we continue to have 1 non-veteran who we hope will be discharged later this week, is doing much better. And so we are seeing an improvement in those numbers. And so we'd ask, please make sure everyone is doing what we've been saying all along. Continue to wear your mask, continue to practice social distancing, continue to practice good hand hygiene. If you are ill, please stay home. None of that changes. I've gotten my vaccine, and if any of that applies, it applies to me too. So I've gotten my first dose. I look forward to getting my second dose, and I do hope that all of our community out there is really looking forward to when you qualify for the vaccine, when you're in the appropriate category and it is available, to please get vaccinated. I encourage our employees and our veterans to make the choice to get vaccinated. With that, I want to thank the city of Amarillo for what you are doing in helping with this communication out to the community, but also in what you're doing towards combating this pandemic with the vaccinations and the treatment. You know, they've mentioned the monoclonal antibody tent that's set up at Northwest BS, and I'm not trying to say it, Dr. Weiss, the BAM tent, I'm just going to call it. I'm not even going to try. You know, we've gotten veterans there to get vaccinated that were seen here, had it, they qualified, and we've gotten a veteran there to be vaccinated, or not vaccinated, excuse me, to get the infusion. And so appreciate that coordination that the city is doing. And with that, I just want to thank our staff and what they're doing and appreciate everything. And thank you again. Have a great day.
Thank you, Dr. Gonzalez. Let's now go to Jared Miller, City Manager. Mr. Miller, how are you today?
Doing good. Thank you, Dave. I just want to remind everyone the drive-through testing center does still remain open. If you have symptoms you feel might be coronavirus, please call 378-6300. They're going to screen you and refer you to the drive-through testing center. If you don't have transportation, Amarillo City Transit is also providing transportation to and from the test, and also when we're operating with vaccinations, to and from vaccinations if needed. Please call Amarillo City Transit at 378-3095. And they will set up your transportation for you. We're operating under two primary executive orders from the governor right now. GA 29 requires face coverings. That's still in effect. There are a few exceptions, but when you're out and about, the main rule is you got to wear those face coverings when you can't social distance and when you're not with family groups. GA 32 requires that businesses, when we're in an area of high hospitalization, which we are right now because our hospitalization rate is over 22% right now, significantly lower than it was a couple of weeks ago. However, we plateaued to 22%. So we need to keep doing everything that we can to reduce that hospitalization rate, to reduce the pressure on our hospitals so that we can then allow our businesses to reopen to back to 75% operation. Right now, all of our businesses, aside from essential businesses and other businesses specifically allowed by name, like churches and other things like that, to remain at 100%. Everything outside of that is limited to 50% operations. Wanted to give a little bit of a little bit more information on the vaccination center, just of it. When we're operating the vaccination center, and I think it's been, I've been looking at emails, texts, and even Facebook Messenger comments from a number of people that have come to the vaccination center over the last week and a half, and everyone says how amazing the organization of that center is. It is an intense logistical operation with between 50 and 80 employees and other staff members there anytime we're operating. That's a whole lot of public health employees. It also includes the nurses that the state has provided, lots of civic center staff that are just really putting in a lot of time, fire and police doing great jobs helping people be organized, fire out there augmenting the nurses in giving vaccinations at times. Other times they're handling the monitoring area after, because you have to stay for 15 minutes to be monitored after the vaccination. On top of that, we've got parks employees giving out water. We've got librarians and library employees working on moving paperwork and documentation from one place to another. Same with city management employees. We have, of course, the Civic Center employees changing the facility on demand to be able to handle people and move people around. When we first opened, with segment 1A or with phase 1A, we had very low demand and didn't have anybody waiting outside. When we moved to 1B, we worked to make sure we had adequate queuing area, but we had people outside. So we immediately worked to bring in other exhibit halls, to bring in the hallways, the area around the Coliseum, the South Exhibit Hall, all of those things to be able to queue people. So we were able to get everyone inside out of the freezing weather. And everyone's just amazed that they can be at the end of a very, very long line and that they never really stop. They're moving the whole time, and that's because our team has just done such a great job of getting those vaccinations in people's arms. I'm sure I left out a department or two. Planning was helping with people that were screening people. We had, I'm going to leave somebody out, but the logistical operation here, and it's a credit to Casey and her team, to our emergency management team, to Kevin Starbuck, to Sherman Bass. There's so many people I could mention, and I'm gonna still leave someone out. But I just wanted to piggyback on what the mayor, on what Casey, on what all of our doctors have said. The operation is a success, and it's a very efficient operation. So I just wanted to thank everyone and kind of give a picture of what it's like to those of you that are watching. We've put out some Twitter stories. We've put some information on social media with lots of pictures to show people what it's like, to show you what you can expect when you go to the vaccination center. So I hope that people take advantage of that. Check it out. It's really interesting, and I think you're going to be pleased when you go get your vaccination. So when you have an opportunity, when your time comes, please don't wait. Please go ahead and come on down. Don't worry about a line. We're going to move that line very fast. So when we have vaccinations, vaccinations available, we really want people to take advantage of that, so that, like the doctor said, the faster we can get it in people's arms, the more attractive a destination we're going to be for vaccinations. Because the last thing the governor wants, the last thing CDC wants, is for vaccinations to sit in a refrigerator. We're putting them in people's arms very fast. That's all I have, Dave.
Thank you, Jared. Now go to members of our media who are participating today. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with Morgan Durden of KVII Channel 7. Morgan, how are you today?
Good, Dave. How are you?
Good, thank you.
My first question is, after someone gets the first shot of the vaccine, is there a time limit that they essentially have to get the second one before the first one would expire?
No, so you need to wait 21 days to get the Pfizer and 28 days to get the Moderna, but there's not a length of time that it would expire. So if you wait, that's the minimum time, but there's not a maximum time. So you wouldn't have to start the series over. You don't have to. There's nothing like that. You just get the second dose anytime after 21 days for Pfizer, 28 days for Moderna.
Thank you. And then my second question is, Dr. Weiss and Dr. Lamentier, you both kind of touched on this, that some people are dealing with long-term effects from the virus. Can you go into a little bit explanation about maybe what some of those are and what they're dealing with?
Yeah, I can start there. Again, the symptoms that we're hearing, not only from some of our employees that have been infected, but also from the public, are things like prolonged fatigue, malaise, problems with prolonged respiratory insufficiency, which means ongoing shortness of breath, and shortness of breath when they're attempting to exert themselves. As you probably have read, there's also ongoing symptoms in some patients with loss of sense of taste and smell. And some folks that resolves over a 3 to 4 week period, and some folks that goes on for months. Those are some of the more common things that we're seeing, again, with people that have prolonged symptoms. I would like to emphasize, however, and not necessarily the prolonged category, but in the severe category, in addition to mortality, which means that some people succumb to the disease because it causes fulminant sepsis and multi-organ system failure, and then ultimately death. And some individuals, we're also seeing those that are not dying having significant vascular complications, blood clots in the veins, some getting blood clots in the arteries. And the question becomes, is some of that secondary to the virus alone, and or some of the intensive therapies that have to be utilized when it comes to the arterial clots to try to support blood pressures when people are in shock? So this is not a disease that is causing mild disease in everyone. And some folks it is, and some folks it's causing very severe complications.
Actually, I agree. I've heard everything that Dr. Lamentier was talking about. You know, one thing several people brought up to me is this brain fog they describe, where they say, you know, sometimes for weeks, if not months, they're having trouble focusing, they're having trouble thinking, you know, attentively. I say the thing that scares me most is, if you look, we've had several patients at Northwest who have been here for actually several months. If you look at their x-ray, their chest x-ray, when they come in, that showed the entire lungs involved with this virus and the pneumonia, you look at it now, there's no change. So it's clear that that's becoming permanent scarring in the lungs. I've actually read some accounts of some young people actually getting lung transplants because of the damage to their lungs that were done by this virus. So yeah, so some people, it really takes a toll on them.
Great, thank you. That was all I had.
Thank you, Morgan. Let's now go to David Gay of the Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. I guess my first question would be for Casey and then the city officials as well. As we all know, the vaccine clinic is closed currently. I guess how quickly could the clinic be put on again, or open again rather, once the vaccine does we get an additional allocation of the vaccine?
So if we're allotted additional vaccine from the state, then we can open the clinic as soon as the vaccine arrives. We have a very nimble crew and are able to stand that clinic up as soon as we receive additional vaccine.
And would you, and with that, are you hoping for, I guess, a specific number of allocation to open the clinic back up in full force, or if you receive less than expected, will you open a portion of the clinic? How will that work?
Dave, that's a tough question. I appreciate it. I think it allows us to kind of describe some of the successes and the challenges. We had 600 doses this morning, and we were able to move through 600 to serve 600 people by about 10:30. So we want to make sure that we're giving vaccine, that we're serving as many people as we can, but we also want to make sure that we're not making people come down and stand in line when we're going to go through vaccine very, very quickly. The other hard part is we don't know how much vaccine we're going to get until it comes. And so that makes it hard for us to plan. It makes it hard for you to plan. We're working to make sure that we have as much visibility on that, but we just don't know exactly what we're going to get until we're going to get it. And so we're going to make sure that as soon as we know, and that we're going to open our line as soon as we can. We also want to make it worth your while to come down here.
David, I would also add that right now, since the Civic Center is not operating, we're leaving it set up for vaccinations all the time. So it's very little lead time. Once we get vaccines, it takes us very little lead time to get up and running. So if we get a delivery in the morning, we'll be able to roll. We can do over 400 vaccinations an hour. Casey mentioned that we were finished with 600 vaccinations by 10:30 or so. That's bearing in mind we didn't start until 9 a.m. With the vaccinations. So we knocked out those in about an hour and a half. So we can staff it with less people if we know that we have less vaccine, but our tendency has been to go into full operations no matter how much we have. Mary, you had something to add?
Yeah, Dave, I just think it's so important for citizens to know we're going to use the website, www.amarilloalerts.com. Almost like that donut store, you can drive by, see if the sign is on and says fresh donuts. Well, we don't want you to come out if we don't have vaccine. So we're updating that real time. And as soon as we get it and we're vaccinating, citizens can know by looking at that website. I also think it's just good to understand this is sort of it's like a three-legged stool. You have to have the facility, which our staff has done a great job of setting it up, and it will stay set up even if the clinic is not open. So the facility we're in control of, and we know it will be available anytime we want it. You have to have the staff. And for the most part, our clinic is staffed by our City of Amarillo staff. We have had some RAC supplemental nurses in there helping us give shots, but we're pretty much in control of the staffing. So we're in control of two legs of the stool. The third leg of the stool is the actual vaccine, and we're not in control of that. We're subject to what the state sends us every week. But we know the manufacturers are ramping up, and we know the supply chain is getting smoothed out. So we believe that our supply will get better and better as time goes on. So I really want citizens to look at that website. There's great information there, but most importantly, we're using it as the primary communications tool for when we have vaccine and when the clinic is open.
That's all the questions I have. Thank you, guys. I appreciate it. Have a good rest of your week.
Thank you, David. And now we'll go to a new media member today. We have Giselle Olivas from Amarillo Telemundo. How are you this morning?
I'm good, thank you. My first question is, have we seen the new strain of the virus yet? And how is the city preparing for when we do start seeing the strain more frequently?
I guess so. As far as we know, we have not seen the new strain. I know Dr. Bell, the public health department, is working on some surveillance techniques to detect it if we do see it. But again, I think the biggest thing about this new strain is we know it seems to have a higher rate of infectivity, but we also do believe that the current vaccine is going to be able to cover this strain. And just remind you that the current vaccines are covering this one protein that's found on the surface of the virus. And we believe that this new strain has a very similar protein. So again, the answer is the same thing we're doing for the old strain: social distancing and masks, and then getting people vaccinated so they can be protected from any of the strains that come through with this COVID-19.
Okay, thank you so much. And another question is, you kind of mentioned it a little bit, but what are other things that health officials are worried about when it comes to this new strain?
Well, I mean, I think I'll take that question. I think that as with any virus that is able to mutate, and all can and all typically do, not unlike what we see with the influenza virus from year to year, it may be that we're going to need to have an annual assessment based upon reinfectivity rates of a potential ongoing vaccine campaign year to year or every couple of years, depending upon what we see in terms of the long-standing benefits with immunity from the vaccine. But usually, as we've seen over years of influenza vaccination, ongoing vaccinations, if they are needed, tend to provide a better prognosis for those individuals who've been vaccinated year after year versus those who never have been vaccinated. Again, because there's typically a subtle change in the virus's jacket, or what we call an antigenic coat. That is the protein on the virus's outer shell. And then we typically have our experts across the country that develop vaccines. They tweak the vaccinations such that we're able to match up closer to that new variation of the jacket the virus is wearing. So our concern would be that, again, we're in a situation where we have to have ongoing supply year after year, like the flu vaccine, but again, not something that's insurmountable.
Perfect. And my final question is just really quick. Do you think the new strain will affect our current situation at all? Like vaccinations, hospitalization, things like that?
I think we're doing the things that we need to do to protect ourselves. We're vaccinating, we're wearing our masks, we're social distancing. We have to keep doing the things that we're doing until we know more about the new strain, and until we are finished fighting the current strain. So we've got a lot going on. We still have to fight the fight, and we have to do that together.
Giselle, bienvenidos. I'm really glad that Telemundo's here on this conference. I think it's really important for our Hispanic community to have direct access to the questions that are on your mind and the answers directly from our doctors and our experts on this panel. So muchas gracias para being here this morning.
Yes, thank you so much, Mayor. I'm glad to be here this morning. And that is all for my part. Thank you.
Thank you, Giselle. Glad to have you. Now going to go to Channel 4, KEMR. I think this might be Aaron Langston, but I could be wrong.
Good morning, Dave. Can you hear me?
Yes, we can.
Okay, this is Judd Baker. I'm stepping in for Aaron this morning. I did want to start off just by asking really quick for some clarification. So are we still on track to be able to get the booster shots for the second round for everyone who's already had the virus, correct? Or that's already had the vaccination, rather?
Yes, the second, those second doses are separate shipments than what the first doses are. Those separate shipments are already scheduled for delivery by the state. We anticipate no issues receiving or administering the second doses.
Okay, and then I wanted to ask, point out a couple things. We had a report from our Austin Bureau yesterday, Maggie Glenn, reporting that Amarillo was one of the few cities in the state of Texas that's really been able to successfully set up a vaccination clinic like we're doing. A couple problems from around the state. In the Rio Grande Valley, we heard yesterday they capped out at 6 a.m. and had to start turning people away by 8 a.m. Down in Lubbock, they've had issues with their phone lines and having problems getting people appointments in that aspect. And in Houston, they're already filled up for the entire month of January appointment-wise. What do y'all attribute the success of our clinic to, and have there been any kind of similar problems that we've seen across the state here in Amarillo and a hurdle we've had to jump over?
So I certainly wish our partners in other parts of the state, we certainly wish them the very best. I know that they will succeed and that they will do a great job. I think that we have been very fortunate here. We were allocated a lot of vaccine early on, and that we were very fortunate in that matter. We also have practiced and exercised this setup for years. When we did the H1N1, when we had the H1N1 pandemic, this is the very setup that we had when we did those H1N1 vaccines. We are also fortunate that every year when we do the flu vaccine for the city staff, this is the same setup that we practice, when we give those city flu vaccines to our city staff, we exercise this same setup. And so when we knew that we needed to give COVID vaccine here in our community, we were ready to go. Our civic center staff, they knew the setup that we use. Our city staff were ready to go. Our public health team are ready to hit their places. So we all practice this setup. We exercise it every year, and we're ready to go. So I think that one of the very best things that we can do is have a plan, exercise it, be ready to go, and then be ready to tweak it. Like Mr. Miller said, we've tweaked that plan every day so that we can make it better. And that's okay to make the plan better every day so that we can make it better to serve our community and our patients. But we've exercised the plan that we have in place, that we've had in place for years and years.
Jared, did you have comments you wanted to add to that?
Well, yes, ma'am. But I certainly didn't want to step on anybody. I think fundamentally there's some differences in how we're going about vaccination in Amarillo versus other places. Some of that's going to be logistical. Some of those populations are so big, like in the Houston area, that you couldn't have a walk-in clinic because you'd have so many people show up at one place. And they're probably using multiple locations. So you have a lot of people show up at one place and not many people show up at another. And it's a little bit herky-jerky that way. And that's one of the reasons why they're doing reservations. And for that, we chose to do a walk-in clinic. We know we can move a lot of people through. And our primary goal was to get vaccinations in arms. Yes, there are trade-offs for all of that. It's a little more organized and you don't have a long line when you have a reservation. You can have long lines, but we've shown, and I think anybody that's been will validate that with our setup, we can move a line really fast. And everyone that we've talked to with the customer service work we've been doing with our parks employees, bringing water, with our some of the public health employees walking around saying, hey, you're this far away, there's a chair right up here, let me help you get over here. We're pulling people that don't have the ability to wait in a line, we're pulling them out right out the front door. We're doing all the customer service stuff we can do. So we made some conscious choices. There's trade-offs on those. We're doing a walk-in clinic, so there is a line, but we're moving that line really fast, and it's really not that much of a hardship. And from what I hear, everyone's really grateful and quite frankly, very impressed with how organized it is. But I think to your question of why are we different from other areas, fundamentally, I think it's probably that choice to go to a walk-in system where you go all in to make sure you can serve that crowd while they're there versus designing the system around a certain amount of people. Our system for sure gets it done fast. 400 an hour is a big number.
And I would add to that I absolutely agree with what Casey said, that they have the knowledge from doing these clinics in the past. This clinic is not like on scale any clinic they've done in the past. They do the annual flu clinic for employees every year. That's 2,300 people. So, I mean, this is definitely a scaled up version on expertise that they already had. And I'll tell you that we've been talking about how to do this for several months now. We did not wait until the week before the vaccine to begin to envision how we were going to do it, how we were going to communicate about it. So again, a big pat on the back to Mr. Miller and to Casey for leading their teams in a way that once the vaccine was delivered to Amarillo, this came up fast. And quickness was always the goal. Quickness in getting the vaccine into arms was always the mission. And they set aside some different ideas about, well, we could do reservations, we could do that, just based on quickness, because we didn't have the infrastructure to have an appointment clinic on this large scale. And rather than wait while we purchase software, IT implements it, all of that, we just went with quickness. And I think it's been a good choice. And I just want for Mr. Miller and for Casey to get the credit for how they took the expertise that we've had from past experience, focused on the top priority, which was quickness, and put a clinic in place that met those goals.
Okay, I think that's all the questions I have. Thank y'all.
Thank you, Judd. Let's now Kevin Welch of KFDA Channel 10. Kevin, how are you today?
Good, Dave. Thank you. Can the doctors just talk a bit about how many of their workers may have declined to take the vaccine?
I think that again, looking at our number one, our medical staff members, we have a combination of both employed and not employed medical staff members, which means they're not employed by BSA. Just to clarify that point, we've had a very high acceptance rate of getting the vaccine, which is over 300 individual medical staff members. And that is extraordinary, and we're very happy about that. For our employed population, we had a percentage that was very quick to accept the vaccine. And again, our numbers now are looking to be somewhere in the 30 to 40% range of employees that have been vaccinated. There are still some more that have said yes, they want the vaccine and are impending getting vaccination this week. So some of that was due to scheduling around the holidays for their personal schedules. And that's about where we stand right now. I think some of the issue is not getting a higher percentage is that some of the individuals have been infected or have been exposed. Some have antibodies and they believe that the timing right now is not best for them. And again, this is not a mandated vaccination. It's voluntary for I think, obvious reasons right now. And those are our statistics currently.
Yeah, I'd say very, very similar to Northwest to what Dr. Lemon was saying. I mean, I was happy to see that really as a lot of the physicians and providers and the medical staff were the first ones lining up. And I think that really needs to be a message to all of us, which is you got the doctors saying, I'm getting this vaccine as quickly as possible. And then with regard to our staff, same thing. We've been able to immunize most of the frontline staff in terms of the highest risk, the ICU nurses, the respiratory therapists. And so what we're seeing is that it's some of the staff that don't have the direct contact with COVID patients who are holding back a little bit. But overall, we've done a good job of being able to get that front line immunized.
I don't know if this is Jared or Casey, but I just want to understand the numbers. It took 8 days to do 12,000 doses, but now you have a capability of 4,000 a day. Is that because of tweaks and demand?
Yes, we can. So those first few days, like the first 2 days, we did about 500 each day, and that's just who came, because we were just strictly doing phase 1A. The next few days we did like 2,100, 2,800. So yes, we can certainly ramp up if we need to, but that we have served we've served everybody who's come. I don't know that there have been many days, maybe just a couple of days where we've had to close the line.
Yeah,
Okay.
and Kevin, I would also add, like Casey said, we had the first couple days were extremely low demand because we were only open to 1As. Once we opened up to 1B, demand started going up, as did the facility, the faculty of our team, the ability to move fast. So this week, I think we hit the absolute stride we can hit. Well, Tuesday we had more injection stations, so we can actually go. We can easily go between 3,000 and 4,000 a day right now. The reason we haven't hit that is we've actually run out of demand. Those days, Tuesday and Wednesday specifically, or no, Monday and Tuesday specifically, great demand in the morning, started tapering off in the afternoon. If we had had that head pressure all throughout the rest of the afternoon, we could have hit those big max numbers. But we started running out of demand late in the afternoons on most of those days. So we can do more than we have done. But because it took us this many days, there's a number of factors there, holiday and just low demand on a couple of days.
Makes sense. Thank you. What will the process be for people who want to get their second dose? Is it just get in line with all the people that are getting their first dose?
Yeah, so right now our team will be meeting today to talk about the specific logistics, but yes, they'll need to bring back, they got a card when they receive their first dose. So, definitely bring back your card. We have everybody entered into M-Track, and so we will have the capacity to have some electronic capacity, but definitely bring back your card at least 28 days after your first dose, and we'll be able to serve you with that second dose.
Okay. And in today's news release, the mayor says that the governor's office is aware that we're vaccinating the entire panhandle. How are we communicating to the regional places that they can come to Amarillo and get a shot?
Dave, I would say we're not going out of our way to tell everyone. We're also we're not turning people away. If somebody comes in from Groover and Panhandle, we're not turning them away. The last thing I want everyone to hear is that we're focused on other areas, but at the same time, the right thing to do is when you have somebody that has an arm that you can put a vaccination in, we're all going to be better. The more people that we get vaccinated, faster we can get it done. So we're not going out of our way to invite everyone down, but at the same time, if we have vaccinations and you're here at our door, we're going to give you a vaccination.
Okay.
And I would expand on that as well, that this is Texas's vaccine. This vaccine is shipped to the state of Texas by the federal government. It's part of the Texas allocation. And part of what we've said from the get-go is we were not going to leave this vaccine sitting on a shelf. We were going to move it out as quickly as possible. So as I've been at the clinic and visited with citizens and visited with people getting vaccines, it's brought my heart a lot of joy to hear people say, I was here visiting family, I'm from Amarillo, I don't live here now. Or I drove my parents in from Sunray so they could get this. So, as our clinic goes on and our supply gets more certain every week to week to week, we know, because Amarillo is the capital of the Panhandle, we know we are an access point for many people in the region. And we want to embrace that role. And so we're still getting the kinks ironed out on our clinic and on the supply of the vaccine. But I've spoken to many people from the surrounding area who have gotten vaccinated at the Amarillo Clinic. And we're proud to be part of their COVID story. And I think there'll be more and more of those people as we go forward, as our clinic is open longer and as the vaccine supply to the clinic becomes more stable week over week. Then we begin to discuss how we communicate out to outlying communities or anyone that needs to come to Amarillo to get a vaccine.
Thank you. And last one, Dr. Weiss, about how long do you expect to feel lousy after getting your second shot?
Well, I'm hoping it's only going to be a day or two, but honestly, I feel great now. So a little acetaminophen and feel fantastic. But I think most of the reports have said no more than about 24 to 48 hours. Seriously, I've taken an impromptu poll among a lot of my colleagues that got their second shot yesterday. I would say that the vast majority of them have had more significant symptoms from this shot than the first one. So I think that's encouraging. That says that first one kind of teed it up, the second one knocks it out, and so we're very excited, but it should be short-lived.
Thanks, everybody.
Thank you, Kevin. Those are all the questions we have for our media at this time. This concludes our news conference for today. Once again, this is David Henry. I'm the communications manager for the city of Amarillo. I want to thank all of our panel members who participated today to provide this information to our community. We do these every Wednesday at 11 a.m. We'll see you next week.